you've got breast augmentation, breast lift, mastopexy, I guess,
Hmm.
and breast reduction. Tell me about those cases, the differences, what those things actually are.
So in general terms, you can make them bigger, smaller, or higher.
Okay. Okay.
that's
Don't be shy.
that's the easiest way to break it down. Nobody wants them lower yet. No one has
Okay.
come and asked for lower breasts.
Oh,
But bigger, smaller, or higher is what we get. And so a breast augmentation is a very common term, breast enhancement surgery, and that literally makes patients a bigger version of who they are. That is the simplest way to think about it. It takes you and makes you a bigger, augmented, or enhanced version of you. Then you have mastopexy or breast lift, which is really a lifting procedure only. A breast lift brings the nipple position up and it removes excess skin, but it does not change the volume of the breast at all.
how do you lift it? How do you lift the breast? Like I know how to put an I've seen an implant get put in, but like when you're lifting it, like what are you doing? What are you attaching it to? Like
So it's most of the time there's different techniques, but in broad terms, you're essentially removing excess skin from the lower portion of the breast
mm,
and then elevating the nipple position. And we have to basically lift up the skin of the breast, or the medical term would be like degloving, basically, or raising a flap, and then shifting the whole breast up higher on the chest and then wrapping that skin around it again in a higher position on the chest. It's kind of wild to watch one because going through the process in the OR, if you haven't done a whole bunch of them and seeing it, you look at it and you're like, this is like a jigsaw puzzle. Like, how is this ever coming back together?
it sounds like it.
And then it does.
Yeah.
And then it does in the end. But so a breast lift is to lift the position of the breast higher on the chest and remove loose or excess skin. And then a reduction is just what it sounds like. So you're taking away excess tissue. Usually, most all the time, a reduction incorporates a lift, but a lift does not have to incorporate a reduction.
Got it. Because I feel like if you're doing a reduction, you take away I guess, the extra
Yes.
adipose tissue that's in there. I feel like the skin is used to more tissue, and so it's gonna sag,
Right.
and
So
so
you got to
that's why
lift.
you gotta
Yeah,
lift it.
exactly.
Now, do you actually cut around the areola and the nipple and move it up yourself, or do you, or is it the
Yes.
skin that you do?
Yes. So one of the most common misperceptions about breast lift and reduction surgery is that patients think we actually remove the nipple and the areola from the breast.
Yeah.
That is totally false.
Okay.
The nipple stays attached to the breast the entire time. And what I explain to patients is we have to maintain blood supply. If that nipple is going to stay alive in the areola, we have to maintain blood supply somehow. So it very much stays attached to the underlying tissues and the breast tissue. And then everything around it is removed and it slides up higher. And then everything, like I said, is kind of wrapped around and the excess is then trimmed.
So can a genetically born female, if she has a breast lift,
Hmm.
can she still breastfeed?
Yes. So I tell every patient that there's no reason you can't attempt to breastfeed. What I do tell any patient that's going to ever consider having breast surgery, whether it's an augmentation, a lift, or reduction, is that the chance that you might have to supplement with formula goes up a little bit. And that's just kind of, I think, a good disclaimer that any plastic surgeon should be telling breast patients. Because anytime you're making an incision on the breast, you are creating scar tissue to some degree, right? And some of that scar tissue might affect some of the milk ducts. And so I tell patients, yeah, you can go ahead and try to breastfeed. You might be completely successful. And I have a lot of patients that have been successful,
Mm.
but you might have to supplement a little bit with formula. Now, the flip side of that is that there's millions of women that have never had breast surgery at all. They have no scars on their breast and they need formula.
Yeah. Right.
So, in breast size does not correlate to ability to breastfeed. We know
Right.
that. So I tell them they can totally do it. They might have to supplement. They might be completely successful, but that's kind of my disclaimer.